News, and yet bone, muscle, joint issues will not stop. And in fact, they are aggravated in a lot of us. And now that we are out at work, there are more issues that we could also be experiencing. So we are back with our bone, muscle, joint episode with Dr. Aashish Arbat, of course. Before we go on to the episode, I would like to, of course, give you an introduction of our platform. TrueWealth is an integrative healthcare initiative guiding patients and healthy individuals to overcome their health concerns and manage self-health to reach the ultimate goal of holistic health and happiness. And TrueWealth aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. It also desires to unleash the therapeutic role and potential of nutrition in curing and preventing diseases. TrueWell's ultimate goal, of course, is to provide integrative and personalized health and nutrition advice to achieve health and happiness. A quick note that this live program, which is actually getting telecasted on 6 different channels, including Facebook, YouTube, and many more. Uh, just take a note that we are trying to create more awareness, give you more information, guidance, so that you will be able to manage through these difficult times and also through your difficult diseases all the time. However, please do not treat any of this to be a personalized consultation, as each of you really would need a personalized consultation. You can always feel free to call us on 9820048369 or on our website www.truewealth.in. Uh, we will be very happy to connect you with our expert, Dr. Aashish Arbat, who's on the show today, with any of your concerns that you could have. You could also type in your comments, concerns, ask your questions in this live show today. In whichever channel you're seeing us, just type in your question, and we sure will try to do more than justice to it. However, note that we do not intend to give any COVID-19 and related treatment advice on this program today. Having said that, I would like to also introduce to you the bone muscle joint series concept. This series is actually started to educate all of us about the bone muscle joint issues in detail. Also basically utilize this downtime that we have to understand the benefits, shortcomings of different techniques that exist. And of course, with Dr. Aashish Arbat, we are learning so many newer techniques that exist, not only in joint replacement, but also we heard a lot of important techniques and tips the last time in trauma. We are going to listen to him on more and more issues we heard on shoulder. So this episode, of course, we will be addressing a very important topic again. These sessions will also help you choose the right techniques, the right implants. At least it will educate you to know about them. Of course, the decision to choose it rightly is of a right surgeon. So this program will also help you choose the right surgeon. And it may not always be in your vicinity, but it has to be the right person treating you. So that's really what you will learn from this program. Apart from which, something which we really believe is important is an integrative management of your disease, and nutrition and diet, of course, plays a very important role in it as well, including physiotherapy and other techniques. But that is what we would be emphasizing on this series, and we are doing this series with Dr. Aashish Arbat. He's one of the first 3D robotic joint replacement surgeons in Western India. He's consultant orthopedic surgeon at the Jehangir Hospital and the Sahyadri Hospital, Pune. He is available at these two hospitals in Pune, and I'm sure the residents in Pune are lucky because these two hospitals are taking care of staying COVID-free. So wherever you're even if you're trying to get yourself operated right now, a lot of safety precautions are being taken. He also also is available at Cure Hospital, Aditi Hospital, and the Ruby Clinic in the Mumbai, Thane, and Kalyan areas. He's, of course, MS in ortho from the coveted KEM Hospital, Mumbai. And he also has an MCH ortho from the Royal College of Surgeons, UK. He's a faculty for UK MCH ortho course. He has a fellowship from the Princeton University in New Jersey, again under a very renowned surgeon, Dr. Jeff Abrams. And he is the first Indian fellow under Dr. Ed Sugaya in shoulder and elbow arthroscopy from Japan. So he's really globe-trotted. He has education and experience from, of course, the UK, US, and you can see Japan. So it's all across that he has gained expertise from. He has a Funabashi Sports Medicine Fellowship as well from Tokyo, Japan. He's been associated with the IPL Gujarat Pro Kabaddi League team and Pune Wrestling Federation. He's been proactively involved in devising patient information systems for the government of Scotland. Not just that, Dr. Aashish Arbat has been doing several different patient programs, camps for his patients, trying to educate more and more. And with the latest techniques, he has been working on very closely with several of the research companies in developing newer techniques and using them aptly and training people in that as well. So we are very happy to have Dr. Aashish Arbat with us today. A quick note on me, because a lot of you all have actually requested me to do that. So I'm, of course, Rajashree Gadgil, and I'm a nutrition expert and the founder and CEO of TRUWELLTH, the platform which you're seeing us right now. I'm also the CEO of RSG Energy and Nutrition in Healthcare Private Limited. I firmly believe that nutrition as a therapy can be modern day's most effective and safe truth in so many ailments, right from lifestyle diseases to autoimmune diseases. And today we are seeing that infections, again, all of us are really, really talking about taking proper nutrition day in, day out. And I have about 20 years of global experience in nutrition formulations, continuing medical education, business strategy, and a lot more. I have an MSc degree from the Science Hospital and also an MBA degree in marketing. So I don't want to brag too much about myself, but having said that, I guess I would definitely welcome our faculty, Dr. Aashish Arbat. Dr. Aashish Arbat, it's such a pleasure again to have you. Every Friday, we really have a good time trying to learn newer techniques and the latest ones, and how they are really good in their outcomes, and how much patient friendly they are, and how much painless. I mean, we have learned about the stitchless ones. It was just fabulous to know that surgeries have become so much easier. And of course, we have seen so many of your stories where your patients are standing on the feet day zero, and they're out of the hospital on the second or the third day. So that's just so amazing. And we're so happy that we did speak about ACL in the last week, and today we are going to talk about ACL and what could be the techniques, especially the internal bracing techniques, and how they are better, how they can actually help scavenge. Um, and that way the surgery becomes easier, faster recovery, and better for the patients. So we would definitely want to know about it first from you. But before that, we would like you to say a few words about our initiative and how you're feeling about being here today.
Hi, Rajashree. It's always a pleasure to see you. And yes, I feel my and yours and some of our generation people, we believe in educating the patients first and make them know what they are suffering from, what are the treatment options available, because I guess it's a human right to know about your options. And likewise, you said it has to be tailor made for every individual, because we come from a background where medicine started late in this part of the world, and it was always followed what the West could have done 10 years back, and then we just followed. And giving an
Yes.
option uh, in only one form. Now that I've been seeing in the subcontinent of Africa, it's like they have only one form of treatment which is available. But since now we are talking about technology, the technology, according to most of the modern writers, it's the future of this planet. So technology has brought us all together, and the technology is just to make our lives better, our work more precise, our reach to more number of people, our expertise to the other level. We are literally opening the other part of our neuro system. So likewise, we are using robotics, we are using keyhole surgeries even in this orthopedics, where it was initially just thought to be, orthopedics is just about haddi jodna. So we are talking about muscles, we are talking about ligaments, we are talking about robotics in joint replacements, we are talking about new materials which lost more than 40 years of life. And we are persistently training ourselves and gaining experience, learning from others, learning from our mistakes, our good things, our results. And Rajashree, near about 5,000 ACLs down in this last around 11 years I've been doing ACLs. We
Wow.
started with open ACLs. We started with bone patella bone grafting. We then moved to double bundle. We then moved to total artificial grafts. Then today we are standing on the platform where we can give them multiple options. So today's topic, like last time we had talked about ACL reconstruction.
Right.
ज्यांच्यामध्ये ACL तुटतं त्यांना आपण सांगितलं होतं की ACL रिकन्स्ट्रक्शन अनिवार्य आहे, नाहीतर त्याचा
Right.
गुडघा खराब होऊन जाणार. ACL म्हणजे गुडघ्यामधलं जे एक लिगामेंट आहे. आय होप मोस्ट ऑफ द पीपल मस्ट हॅव वॉच्ड our last session, and it was a very good session. It was repeated 2 times. Today we are talking about what are the newer techniques where can we save the native ACL, especially in the young crowd, the age group of from 12 to 25 to 30, in these young people, in athletes, and in people who have the growth potential. So growth potential is there up to 25 to early 30s, where we, instead of reconstructing, are there any techniques that we can repair the ACL? So this is one concept where even last ACL talk, somebody had an asked a question, ki, doctor, can you talk about internal bracing and the latest techniques? So Rajashree, we are going to talk about the latest in conserving the ACL.
Right.
Uh, More than that, saving the native ACL by surgery.
Sure. Yeah. So, having said that, I think, if you could just give us a brief of, usual techniques that, right now there are so many newer ones, and you're going to talk especially about a specific technique, which is the internal bracing and other similar techniques. Does this really have a different impact in the younger patients and the older ones? And is, in especially in the younger ones, do these kind of therapies really help in scavenging most of their uh, is there a possibility of that with these techniques?
Yeah. So I just let me share my screen.
Sure.
If See, this is a paper.
Mm-hmm.
Uh, this started in
Yeah,
Sweden in 2000,
that's
late
great. Yeah.
2018,
Mm-hmm.
and what they suggested is, if it is an
Yeah.
early repair, you can see the screen here.
Right.
I hope you can see. So if it's an acute ACL,
Mm-hmm.
near about 12 weeks, we do a MRI. The algorithm, I'm telling the algorithm of the latest
Correct.
techniques, that is an internal brace and all inside technique. We do an MRI
Sure.
confirmation of the acute ACL.
Okay.
So there is a inclusion criteria. So every person, we cannot do this internal bracing. It has to be early. And if the surgery is possible within 4 weeks, if the person comes early, he's a sportsman, he's an IPL player, or he's a footballer, and we
Mm.
want to do some early intervention if it's an ACL. So
Okay.
we have an interoperative eligibility criteria, which I'll be discussing, and we can repair And this study was all focused on whether the latest technique works or not. It's a editorial in a very big journal. So you can see a lot of literature on it. So
Yeah,
look at this. So this is the
totally
criteria.
evidence based.
Yeah, it's a total evidence based talk today. So
Yeah,
there is a grading A, B,
yeah,
C, 1 to 3. So A, B, C is when the ACL is broken at the femoral end. Sometimes it is the central end, and sometimes the tibial end. Or whether it is more than one strand, two strands, and that we decide on table. So in criteria 1, if it is completely intact, yes, we can do the internal bracing. So young people who come and ask me, "Ki, sir, is my MRI, can I save my ACL?" Yes.
okay,
If he is more than 50% intact, yes. But when you come late, when the ACL is degenerated more than 3 months, or it is
right.
completely high grade rupture, then we cannot do the internal bracing. So what is a basic concept is, we don't want to put a graft
Mm-hmm.
for reconstructing. We can repair, which was till date over these
Yeah,
30 years of ACL reconstruction. We used to completely repair, remove that part, reconstruct the graft with a graft like what we are seeing here. So now, uh, this is what we used to do.
right.
This is the graft, and we used to place it with screws, or like last time we decided. But
Yeah,
now, instead of putting a new graft, the graft we take it from the fascia or some ligament or some muscle, and there is a one more site of operating. But if it is a early stage, we can just do something called as an internal brace, where we can save the ligament, and there are two techniques: the Lagame's technique and something called as the internal brace. It's a
right.
simple technique developed by Arthrex GmbH, Germany, and the US. And here you can see we are not putting any graft
Right.
in the tone ACL. Again, I told you more than 50% has to be intact. It has to be a partial tear. So whenever many people get a partial tear in their MRI, so the concept is we cannot conserve it anyways, because it is going to go complete into complete tear. But if there is a complete tear, just a bony detachment from here or here, we can do something called as the internal bracing without damaging any of the structures, and totally arthroscopically, endoscopically. So there are excellent results. I'll just share.
Yeah.
That's what I was talking. I'll share some video uh,
Mm-hmm.
how we do it, and what are the techniques that are
So
latest
we
in it.
fortunately learned from you that the timing is very important, and
Yes,
to reach the right surgeon at the right
yes.
time. I think that is really very critical, so that the
So
surgeon can assess this technique especially, and save the ACL if possible.
yeah. So last time, Rajashree, as we discussed that in the regular ACL, people who must have watched or people who are
Hmm.
watching today, we arthroscopically repair or reconstruct the ACL. In the regular ACL, when people do a regular, or the most of the people that are doing the ACL, they remove a graft, which can be from the fascia, the last time that we discussed, or from the muscle part, and then they fix it on both the femur and down. But when we do something called as an internal bracing, so
Yeah.
the external brace and the internal brace. The internal brace is a specified suture material that we repair the graft. If I can share the video, uh, is it seen, Rajashree?
Yes.
So I'll make it to full screen. So something like this, which we see, this acute ACL tear in the MRI. This is something that we see. So this is a PCL.
Yeah.
This is a completely torn ACL. There are specialized instruments that we use, and endoscopically we see this is the internal part of the ACL, and see some part which we go when I normally see that in many big tears, the ACL is completely torn. But here, this is an endoscopic, arthroscopic view where what we do is instead of taking out the ACL, we suture it with specialized sutures and tie it around itself. Can you see that?
Yeah.
And we try to save the native ACL. What we do is we induce endoscopically some bleeding points inside. It is completely stitchless and painless procedure. As you can see, it is done with keyhole. This is our scope, and this is a keyhole procedure, and it is completely
Oh,
computerized.
yeah.
It is completely computerized. There is no suture, there is no scar, and internally, what we do is, can you see this? We pass a specialized brace inside. Can you see this?
Yes.
And that takes over the tone part of the ACL. See, basically, we need to have a silhouette where the ACL regrows, and we suture that brace back on and then give multiple movements. See, there is no scar, Rajashree. There is no scar. Patient can go home
Mm-hmm.
within 4 to 6 hours of surgery,
Yeah.
or at least the next day morning. So, basic concept here is not to do any other damage to the any other tissue. So, like I was discussing in that paper,
Yeah.
that we need not do any big surgery. And what are the results? So if I can share the paper again with you all.
Yeah.
So give me a second. So here are the results. So what we do is, there is some scoring that we do. We see intraoperative knee function, pivot shift, and day one we return to work, and the surgery interval, the return to work in this internal bracing starts from day one. Within 2 weeks, we see there is some brace given on the external thing, and we start within 6 weeks. We can allow the sportsman or the player to start the sport or working. So there are enough papers that we see, and there are no complications. As we They have been studying it for last, the paper is going on from 2018, and they're going to study it to 2020. So here you can see, instead of putting the graft, we are going to just repair your ACL back with a special suturing technique, totally endoscopically. And what they have seen is, uh, there are no other complications. There are no bony tunnels extra. There are no uh, any other interventions that we do in the regular ACL. Yes, it is a new technique. It is limited to the type 1 and type 2 kind of injuries, and we are restricting it for age from 18 to 40 in the US, but in India from age to 18 to 30. And there are certain restrictions when you have more than 3 months of this injury, when you are more than 40 years old, where we don't do this. And you have to have a good native ACL inside, where we can save. The beauty of this procedure, Rajashree, is that
Mm-hmm.
we don't, now again coming back to the criteria,
Yeah.
uh, we can repair within the first 4 weeks of surgery to 1 month. So if you come to us within the 1 month,
Mm-hmm.
so we can do this repair, not a reconstruction of the ACL. And the results are really promising. There are extensive studies on this. It is available in India now, and we are doing it. We have those special sutures called the internal brace that we are using in the ACL reconstruction. And as all of us know, that we also do something called as a all inside technique that I last time discussed, and it is completely under regional anesthesia. You are totally conscious. You can walk within 4 hours of surgery, and you can start rehabilitation, which we normally started after 3 weeks from day one. So you can hit the gym, you can go to any activity immediately uh, within the first week of surgery, and within 3 weeks you're back to sports.
Uh, that's really very promising
Yes.
to know actually, and yeah, it's great that out of your experience and continuously the way you are trying to learn and master so many of the newer techniques in so many different areas and trying to get them for the patients yeah, is really great. Surgery, like you say, has moved. Has come such a long way. I mean, we can't even imagine that these procedures sound as though they'll be quickly done and people can actually be relieved, even when they may not be done may not be done as well the first time. And now we are talking about repairs out here. So when we are actually doing these repairs, what are normally you know uh, the prevention and the management techniques that you normally you and your team follow, so as to prevent any complications, because already this is something you are repairing, and since you have seen great results, I'm sure there is more than just the surgery and the technique that you are actually adding to it as usual that you
So
do.
we can, Rajashree, we can just share the last time's
Hmm.
video if people have not watched what we regularly
Sure.
do in the ACL. So this is
Yes.
what we were showing in street, that when you fall down,
Hmm.
normally you get this kind of an ACL tear. I hope it is seen. So this is the
Yes.
ACL rupture, and now what we are talking, if it is a high grade tear, we need to reconstruct it, and that's what we always been propagating of reconstruction of the ACL. But in the new technique, so we are using a lot of lasers. We are using a lot of new techniques of anesthesia. Also, we are we are giving uh, anesthesia under sonography, which is totally painless. Patient is totally conscious. It is a computerized anesthesia, and we use something like this where it is completely endoscopic and arthroscopy with laser, and then these were the grafts that were used, Rajashree, for most of the ACLs, and this was the all inside technique that we propagate for a ligament reconstruction. But even now we are, if we possible, we don't need this graft. So you can see the difference, that we need not put any foreign graft or autograft. If you come to us in time, we can just use the internal brace technique, and the results are dramatic. People are doing all the activities. We need not touch any graph. There are a lot of sports people that we operated, where we use the internal brace, and they are returning back to sports. So especially the boys, especially the girls who are into a lot of sporty activities, who are very young, they can go for these uh, internal brace technique. They can reach out to us. They can ask Dr. Duhana. Today only we got one student who is a medical student who wanted to get an internal brace technique done because he had an acute injury, and once we found out the MRI there is a partial tear, we gave an option. So boys and girls, men and women who understand the technology, who love technology, who want the best for them and what is the latest for them, I think internal brace uh, will be the future of acute ACLs, and people who want their ACL to be their own without any graft from their body or outside. And basically, this will provide a silhouette for the original graft to grow. So it is your own graft. The nerves are yours. There is no damage to your internal structure, and again there is no extra scar on any other body part for the graft. And if possible, ACLs which are tackled very early, internal brace and all inside technique is the latest that we can offer in our, it's a one more feather in the cap. And we can offer one more in our cafeteria approach. Now I always keep on talking that give options to the patients, so when in the cardiac also they give stents, they give medicated stents and this and that. In neurology they have lithotripsy in this. So in our joint replacements we are giving regular joint replacement and anatomical robotics. Even in ACL, now in any ligament, we can give this internal brace. And one more option to the young crowd who don't want a graft, no extra scar, and who want to really go back to their sports very early. And it is massively early because it was in terms of months. Now we talk in days and weeks.
Great. So yeah, that again, it was good that I think you did share that video from the last time as well. I think it makes it more easier to understand the same. So is there a lot of, I mean, if you want to sort of point out what are really the differences between the regular techniques and the advanced ones which you are using, especially the internal bracing technique.
So likewise, I said the internal bracing, Rajesh, I shared the video also that we
Yes,
don't do
yes,
any grafting.
yeah,
So there is no external scar. We just go in like you saw in the video. We just go
yes,
in, we suture the torn part of the
yes,
ligament, and we take it back to where it is, and we put one more
right,
artificial brace, which is made of specialized material, which is a combination of a lot of biodegradable materials and some specialized metals. And uh, this brace dissolves in the body within a matter of 9 months. Till then your new ACL comes out, so you need not have any worry of taking out the implant, or where there is no implant inside. So we are just making a railroad so that your native ACL can grow back to the normal area. We are doing some
okay,
microfractures, and once your native ACL grows, you are technically a non-operated person because it is your own
right,
ACL. So
right,
it is like just
absolutely,
saving the ACL and repairing it back, like without any foreign material to stay for long. And there is
right,
no graft in it. That's a big difference. And if my knee was young, see now again, Rajashree, it
yeah,
is not the age. If your
yeah,
knee is really healthy, what happens is people do an MRI and people advise them go take rest for 3 weeks and this and that. But
correct,
anyway, they have to be operated early, and anyways they have to be operated for ACL, because if you conserve the ACL, it is 70% chance in the next 6 years you're going to get arthritic if
correct,
you're a
yes,
young active adult.
yes,
So in the
yeah,
age group of around 18 to 50, and if your really good knees, good x-rays, and the cartilage in the MRI is good, we would advise, instead of going for a reconstruction later on, we
yeah.
should go for a repair, because there is nothing like saving your own body structure, what nature, God, or whatever, it has given it to you. So the whole idea of this technology, this concept, is to save the original ACL, and the patient gets his original ACL back in place. Second thing, in the younger population, like we have now boys and girls who are playing football and contact sports at a very early age, and I've seen ACLs and a lot of sports injuries in these young adults. In there, instead of taking a graft, because we are going to get a very small graft from that boy who is 18, 15, 14 years old. In that, if the parents get the kid early, we can just suture it back with an internal brace and send him home. And the healing powers in this age group is massive, Rajashree. So there where we can give them an offer of internal bracing instead of a reconstruction.
Great. So on that note, actually, I would like to also, share a few inputs on in terms of, nutrition, and that really, I mean, what you explained, it really takes care of things like, what we are worried about is normally the long-term effects of an ACL reconstruction. But the way you rightly explained to us that, it's your own thing. So, the complications and the long-term effects or the long-term effect is going to be much it's in fact not going to be there. And also the arthritis that you mentioned, so in terms of knee pain also, in those aspects also, this is actually going to help much better than the usual techniques. And which is why I just want to give a few tips to our viewers in terms of what can be the diets. I think what people could normally follow in these kind of conditions. And let me quickly explain. Of course, to take care, first of all, let me actually explain in terms of what needs to be done so that we could secure ourselves from getting any further damage from to our knees later, which we are talking about arthritis. But when we are actually trying to trying to take care of our post-surgical recoveries, I think that is also important. While we are doing that, of course, always having a balanced diet with a lot of positivity, and balanced diet does need to include almost 30-35% of protein. In our plate, we should have good amount of whole grains, vegetables, fruits, and a balanced plate, which I've of course put in front of you. It's extremely important, not only post-surgically, but also pre-surgically. If you're well-fed and you have a good nutrition and a good nutritional status, then these surgeries and the recoveries are much better, and of course, the after effects are also much lesser. So it is extremely important for building bone and muscle, keeping the energy, and getting good recovery of the cells and quicker recovery. We need to increase our amount of protein to about 35 to 40, ideally 40%, and reduce your carb input, and keep decent amount of good fats going also, because they are extremely important also in recovery. It is not only important to just see that how much quantity of protein you're eating, but also the crucial amino acids like isoleucine, leucine, valine, and glutamine and arginine. I keep stressing are two amino acids which are extremely important. So when you choosing the protein diet, or you're choosing the protein supplements, we need to make sure that these two amino acids are consumed well, because they not only help gravely in increasing muscle and bone strength, but also in the process of recovery, it enhances that. It has been shown to reduce hospital stay in several studies. Also, currently the most, the anxious moment that we have is about immunity. So it also helps in building immunity. So, you do not contest any infections, and recovery is much faster. There are several foods that, especially if you are a non-vegetarian, you're better off, because you can eat chicken, fish, tuna, fish, and so many fishes, and especially chicken. If you can eat, you can get about 20 to 35 grams of protein per serve. If not, if you're a vegetarian, we need to rely on milk, yogurts, cheese, cottage cheese, beans, and nuts, which also have good amount of protein. And if you are able to consume good amounts of it, that can take care of it. Also, we need to correct our vitamin mineral deficiencies, which are, because these are again very important for the uptake of they need to be taken together, because all the uptake of minerals is extremely again important, and vitamins is important for the uptake of all the good nutrients that we are eating. So in order to strengthen our bones and muscles and the recovery process, vitamin deficiencies definitely need to be corrected. So all in all, what we see here is that we need to have a mix of proteins, vitamins, minerals, and antioxidants, because they again are going to keep you, keep the recovery faster, keep the oxidative stress lower, which will actually help the recovery process as well. So understand that again, proteins are broken down because of the enzymes, and which is why the enzymes again are extremely important. I keep stressing on this aspect, because no matter how much protein you're going to consume, because you're told no matter how much of vitamins, minerals you're going to consume, that you're given, if enzymes are not sufficient, the uptake and the digestion isn't complete, and the uptake isn't complete, then all those critical, the recovery and the immunity nutrients, which will actually not be absorbed by your body, and then it's really going to be useless. So taking an enzyme supplementation post-surgically is actually an ideal thing. Also, apart from just balancing your macronutrients, that is your proteins, carbohydrates, and fats, you should also balance your alkaline and acidic foods. That's something I highly recommend, because this is extremely important to keep inflammatory foods away. Because if inflammation is kept under control, then your risk of having an arthritis again ahead is curbed. So also the antioxidants need to be consumed, because oxidative stress. This is what oxidative stress does to your, say, internal cells. What happens to apples happens to your cells inside the body. So understand the fact that inflammation and oxidative stress, these are two most notorious elements which are all the time going inside our body, and these are processes actually of our immune system and our cell system, so that there is continuous repair and continuous scavenging of our body from the microorganisms. So this is continuously going, but if this becomes chronic and it keeps continuing on, then it can be very, very harmful. And if we are able to control these, there are so many different ingredients and nutrients that are available right now that could be taken. Includes good amounts of vitamin C, glucosamine, MSM, and vitamin minerals, along with some of our ancient insights which we have been already consuming, and now this is worldwide being consumed, is Google. So, Boswellia serrata and Commiphora mucola, two types of Googles which have shown, there are studies showing that they bring down inflammation. Also, ashwagandha, which is Withania somnifera, is worldwide famous for keeping the inflammation lower. Rosehip, and of course curcumin, that is turmeric that we know, and ginger. These are some ingredients we should consume in foods. And also people who have gone through ACL surgery, because they are definitely more prone to the to an arthritis, need to consume this as a preventive. So taking these kind of supplements, which can actually put together, keep the inflammation processes here. There are these different COX-2, LOX, and these are all these inflammatory processes in our body, which elements like Boswellia, curcumin, glucosamine, Withania somnifera can actually cut and keep them under control. They promote anti-inflammatory actions also, and which is the reason why you can actually have both good recovery and prevention to arthritis. So that's in addition to what Dr. Arbat said, but this is something that he and I practice together. So and it is something which he firmly believes in, and that's good that more so than we believe. He also has a good belief in not only doing surgeries when extremely needed, using the right techniques, but also using these preventive techniques, which will actually preventive and recovery techniques, I would say, which make his surgical techniques very, very successful for a long term. So Dr. Albert, that is something which is very interesting, and we always like to do that work with you. If you would like to add any more comments on that front, otherwise we can go to a few more questions.
Yeah, no comments, Rajashree. Basically, people should understand that ACL is like a rubber band. When it breaks, no matter what, you cannot save it. But and then people will advise reconstructive surgeries, because I think people are afraid of reconstruction, the graft, and if you have an option of saving it, and if you do it in time, it can really be a very, very simple and very straightforward procedure. Uh, Visa, your surgeon should be able to do it, and they should have the right techniques and the right availability of things, where uh, now I think reconstruction might in some time become obsolete for young healthy adults who come early, and we would completely give them this option of internal bracing and without any grafting if the graft is intact. And we
Wow.
have all the things ready in the kitty for every case, that where we can save the ligament instead of taking it out and reconstructing it, we can repair it. And it is, the word itself says that if you repair it and not reconstruct it, the results are going to be unknowingly good. I feel when it is your own nature, when it's your own body structure, why not save it instead of, it's the difference between an open heart surgery and an angioplasty. If it's your own structure,
Correct.
it's your own thing,
Correct.
it really helps. It will help. And that's our school of thought.
Sure. So I think today we did get a complete holistic understanding of this technique from age related to how we are scavenging our own body parts, and how you gave a very good example of an open heart and surgery versus doing a bypass versus doing a angioplasty. But understanding that and understanding how successfully you are actually conducting are able to conduct these repairs because of this which looks like a very simple technique, but something which is absolutely new and does need a good expertise. So from that standpoint, would you like to comment on, because I know this is an area um, uh, where we have to be very very cautious in terms of choosing a surgeon. Would you like to throw any light on that? What are the type of surgeons that our viewers should understand that they should be visiting in case they're already now that they need a ACL repair? And at times, how do they even understand that that they need a ACL repair really?
See, I'll divide it into a systematic thing. ACL might not see if you have a history of fall or a sports injury or a bike injury, and immediately you might. There are times in 60% of people you don't have pain, but the commonest complaint that people have in ACL or any ligament is the instability. The knee is unstable. The commonest complaint that they will face is they're not their confidence of running sports, riding a bike, that goes down. They feel that knee is unstable, it is twisting, it is just buckling out. These are the people who definitely want to reach out to people like us who are trained in sports medicine and arthroscopy, where we are all available online in these times where uh, even Google, if you search out for a good surgeon, you can just find it out who can do it. And there, when you meet a surgeon, you can ask, doctor, can I go for an internal bracing? Because most of us would know an MRI, most of us know that we have a ligament tear. And there are sports people who know after the particular injury, they give us a complaint the next day, doctor, there was some pop heard in my knee, and I am having a lot of swelling. And there is the one of the earliest symptom of an ACL tear is you have a massive swelling, might with or without pain, immediately after the fall. X-rays will be absolutely okay. The X-ray guy or the regular doctor would say that yeah, your ligament, your knee is absolutely okay in the terms of fracture, but yes, there might be an internal injury where your ligament must have been popped out. And when you can reach to people like us and we suspect something, we could do an early MRI. And there are times in the periphery where doctors take out the massive swelling. And to the juniors who are might see this video or further videos, if it's a hematoma without a fracture in the X-ray, and it's a hematoma, collection of blood in the knee where you aspirate pure blood, 99% times it's an ACL injury, because the genicular artery breaks, the vessels break along with it. So that is one type of people who can reach us. And if they come within the first month, we can really give them an option of uh, uh, internal bracing. Young people, young boys, girls who have a skating injury, who have some football injury, and they come home and tell that mom, I had a big fall and I have a lot of swelling. In that kind of people, they could reach especially the pediatric population, young adolescents, young boys, young girls, college goers, and the students. These kind of people, we can give an early option of this thing, and they don't waste time. The next day morning they start studying, walking, doing all their activities. It's just a matter of a day. Parents should understand that it is for their future life. Instead of wasting time on some fear-based notions, you can reach out to us that, doctor, that there is some ligament issue in my kid. And in pediatric population, we have to take care of saving the structures because they are in a growth area where we don't really get any grafts. So I have seen that lot of pediatric population, young adults, adolescents, juniors, they are conserved by the regular doctors because they really don't know is there an option. And the ACL becomes a chronic ACL, and the knee starts changing shape in an abnormal way, which I've seen when they come for us for joint replacements. And if they have an old ACL injury in the childhood, their knee stabilizes posteriorly. They have a high posterior lip paste femur, and the tibia is in an abnormal shape because there is no ACL since the childhood. If these kind of people come, we can really give them a natural ACL. And young boys and girls who want to go back to sports, who don't want and graft and don't want to waste their precious time. Rajesh, what happens is when you waste those time, the blood supply of the ACL goes and the ACL starts shrinking in matter of 2 to 3 months, and we have no option left other than doing a reconstruction. Again, because of instability, they have meniscal tears, they have multiple falls, their sports activities goes down. So people who really want to go to the army, who are having marks, there are some schools and colleges who give
Yeah.
5 to 10 marks more to the students who are pursuing sports, and they really score very well. uh, so they will be placed very high. I've seen even during my times they used to go more than 100%, 103 out of 100, 104. Those marks are the sports marks. So in these people, if you can pick out these injuries, the coaches, the people, especially the badminton and the table tennis and all those kind of sports which the boys and girls play, if they have this kind of instability, they are not performing well, you can really come and ask us. Instead of giving them any external brace, we can give them an internal brace, and then go back to sports with the full activity with the week, and their ACL will regrow. We need to regrow things, and we are going to talk about a lot of cartilage transfers, and to how to prevent the TKR, and how to prevent a hip replacement. And in coming times, keep on watching us for conservative orthopedics, because surgery every time conservative doesn't mean you give medicines. Conservation can be a surgical conservation also.
Totally, that's exactly what I was trying to say. That from that standpoint, you completely holistically look at it, and all the important points that you pointed out right now were, I mean, they are so important for all of us to know. And going to the preventive techniques, I know we are going to also bring up more programs which will talk about completely preventive treatments. So really looking forward to those shows as well. So I think I did try to address some of the questions that had come from some of the viewers, especially because they obviously have the concern how when you're going for there is anxiety around it when you're going for a repair, and how to first of all understand that you need an ACL, but ACL repair really. And then if the techniques are going to be such that they are actually going to reduce the further risk, why shouldn't people be opting for it? And I think more and more I've seen in a lot of support groups where people having done their ACLs are really very anxious after they have and done with the ACL surgery. And so many of them keep feeling that they're getting a pain for a long time, and not sure if when is the time that they're going to recover, and if at all they need an ACL repair. But so I think your today's talk really gave us a good light on that front. And thank you so much for taking the time out again this week as well, because and we love the
Rajashree, to
fact that
mention one thing that you're talking about the pain. And see, actually we are grafting it from some other areas. So we are taking a hamstring graft
right.
or a graft from the from the foot. In young adults, we really don't know, all of us, that whether this graft is going to take up or not. But logistically speaking, the logic, the rationalism, So in the rational thought process, if it is your own tissue which is there for so many years, we can just put it back. And I feel in coming time the studies will show that this kind of procedures, the healing is better in the young adults. And we will be shocked. I think we are there are a school of thought where they reconstruct everything uh, in the ACL. I think we should rationalize it that if it's your own tissue, it will heal better than any graft. I think that is no rocket science. That's what I feel. But you have to reach in time.
Sure. So all the points really covered today, and we are over an hour, and we didn't even realize that we saw the techniques through your presentations and also the videos. They're always so much easy to understand, and that is what we are also getting as a feedback from the viewers. We also have viewers commenting right now that it's a good discussion and good to know about these things. A lot of thumbs up coming up on our different channels. Also on YouTube, we are having viewers watching us. So that's a good thing. Our last program, of course, has reached almost 10,000 people, which we had conducted on ACL, and on that point, actually, thanks to you, of course, and also my backend team, who has been relentlessly actually sharing all our programs to different groups where it is more relevant and for people to actually view them and understand these different techniques. And not only is that going to create education, but also it's going to help people reach their doctors at the right time, and also make sure that they can actually get access to these newer techniques, and while they understand how good they are, and the how less risk it poses, and they also now know what the recovery times are. So they don't have to worry as much as they had to earlier. So having said that, I think we would like to thank you for coming down, and I would also like to thank our viewers for giving us so much of a response, encouraging us, and by of course making use of the information that we are sharing. And we are really still going through these tough times, but through that, if this is the way we can actually manage our pain, and also take care of any sort of surgical procedures that we may need. We shouldn't be pushing surgeries too much ahead. We've already done that for past few months, but now is not the time. If it is a critical surgery or not, of course, you can reach out to Dr. Aashish Arbat directly, or you can actually reach us on our lines as well, so that we can you can get in touch with them online first of all, and figure out if you are really going to need a procedure, or can you manage without it for some time. And that's how, if it is urgent to be if it is urgent for you to go for a surgery, you must be going ahead with it. Having said that, Dr. Ashish Arbat, if you would like to add a couple of points and end the show, thank you again for being on our show today.
And Rajashree, yes, we have to understand that the difficult times now that we all of know that how to live with it. There are certain, like we are eating every day, we are sleeping every day. We have to take care of our body. We cannot just keep on crying that there is COVID, then there is some tsunami, there is some this. Life moves on. It has always been. It's been 10 million years that humans have survived a lot of natural calamities, self-made calamities, wars, and I think this is a new normal. All our hospitals are now knowing what to do of this uh, new problem that has arisen in the COVID form. Uh, it's not more deadly now, but there are times that we have to really take decisions. Most of the centers that we operate are COVID free, and if we do it in time, we should not regret, because one thing, Rajeshri, I've seen about health: once you lose it, we have our species, we are not lizards, we are not reptiles that we can regrow our structures. We should do it in time, and that is the responsibility to ourselves, our own body, because that's the only place where you are staying. It is our temple. We have to take care of our body first, then the rest will fall in place. Health is wealth. It's always my one line. So whatever it takes to be healthy, and if it needs a repair, it needs a reconstruction, if it needs a cancer to be removed, it needs a graft ACL, or it's a reconstruction or a TKR, please do it on time. That all matters. Time is muscle and money.
Great. So on that note, we would say a goodbye to you, but we will of course be back with a newer topic next time with a complete holistic approach, and of course the newer techniques will be exhibited by Dr. Arbat with all the good and the pros and the cons presented to you, and of course his experiences through his videos, and also the procedures through his videos, which are so easy to understand. Thank you again, and
Thank you.
goodbye. On that note, I'm just going to, of course, uh, put showcase the video of our sponsor, RSG Energia, as they are relentlessly being supporting our efforts in actually trying to educate you on all the aspects. So a quick video on that before we end.